How to prevent kennel cough. Kennel cough is a respiratory disease, otherwise known as infectious canine tracheobronchitis. It is caused by both viral and bacterial diseases, the most common causes being the bacteria Bordetella bronchiseptica and the canine para-influenza virus. Essentially, it is an infection of the windpipe and the voice box similar to human bronchitis. The disease is highly contagious, but there are steps you, as a dog owner, can take to prevent your dog from coming down with it. Just as human colds may be caused by many different viruses, kennel cough itself can have multiple causes. One of the most common culprits is a bacterium called Bordetella bronchiseptica M, which is why kennel cough is often called Bordetella. Most dogs that become infected with Bordetella are infected with a virus at the same time. These viruses, which are known to make dogs more susceptible to contracting Bordetella infection, include canine adenovirus, canine distemper virus, canine herpes virus, para-influenza virus and canine reovirus. Dogs catch kennel cough when they inhale bacteria or virus particles into their respiratory tract. This tract is normally lined with a coating of mucus that traps infectious particles, but there are a number of factors that can weaken this protection and make dogs prone to kennel cough infection, which results in inflammation of the larynx, voice box, and trachea, windpipe. These factors include exposure to crowded and/or poorly ventilated conditions, such as are found in many kennels and shelters. Cold temperatures. Exposure to dust or cigarette smoke. Travel-induced stress. Symptoms of kennel cough. The classic symptom of kennel cough is a persistent, forceful cough. It often sounds like a goose honk. This is distinct from a cough-like sound made by some dogs, especially little ones, which is called a reverse sneeze. Reverse sneezes can be normal in certain dogs and breeds, and usually only indicates the presence of post-nasal drip or a slight irritation of the throat. Some dogs with kennel cough may show other symptoms of illness, including sneezing, a runny nose, or eye discharge. If your dog has kennel cough, he probably will not lose his appetite or have a decreased energy level. Treating and preventing kennel cough. Kennel cough is contagious. If you think your dog might have the condition, you should keep him away from other animals and contact your veterinarian. Preventing kennel cough. Get your dog vaccinated. The primary way to prevent kennel cough is to keep your dog vaccinated. The core vaccine also includes vaccination against common viruses that contribute to kennel cough development. There is also a vaccine effective against Bordetella bronchiseptica, which can also cause kennel cough. Your veterinarian will let you know which vaccinations are more important for your dog to receive. Get your dog's vaccination updated. Just doing the vaccination one time is not effective forever. You need to get your dog a booster of its vaccination on a regular basis. In general, the first booster is given after 1 year, and then subsequent boosters are given every 3 years. New strains of kennel cough occur regularly. Getting your dog's vaccination updated can increase the likelihood that your dog will be protected. Because of the many causes of kennel cough, vaccination will not guarantee 100% that your dog will not get the disease. However, it will reduce the chances considerably. Keep unvaccinated dogs away from other dogs. Dogs and puppies that are exposed to a lot of other dogs are at increased risk for this disease. This contact can occur at dog parks, groomers, puppy classes, obedience classes, and boarding at kennels. Keeping puppies isolated from other dogs, except litter mates and the mother, until they can get vaccinated is a good idea. Puppies don't usually get vaccinated against the causes of kennel cough until they are around 4 months old. However, some of the intranasal drops can be given to puppies as young as 3 weeks of age. Don't allow your dog to drink out of communal water dishes. When dogs drink out of a common bowl, droplets from an infected dog's nasal and mouth secretion can contaminate the water and bowl with Bordetella. When an uninfected and unvaccinated dog laps the water, it can contract the bacteria and come down with kennel cough. To avoid this completely, don't share water or food bowls and wash them frequently in hot, soapy water. The same applies to toys that dogs may share while they are playing. Identifying and treating kennel cough. Look for the symptoms of kennel cough. The most notable sign of a dog with kennel cough is a persistent cough. The dog will cough continuously with a distinctive goose honk sound. Many times this is the only sign in the dog, with it appearing healthy otherwise. However, this cough lingers on for weeks, and some dogs will also show other signs such as gagging or coughing up a white foamy phlegm, fever, discharge from the nose, watery eyes, decreased appetite. Keep an eye out for symptoms of an even more severe infection. Occasionally, kennel cough can make a dog susceptible to developing pneumonia. This will make a dog experience more severe symptoms, including lethargy, difficulty breathing and, even in a few cases, death. Keep a dog with possible infection away from other dogs. It's important to limit the risk of spreading the disease, even if you are not sure if your dog actually has it. This is the responsible thing to do. Keep your dog away from dog parks or facilities that care for dogs, such as doggy daycares and boarding facilities, until your vet has cleared your dog's health. Pick up your dog's feces. You should probably do this whether your dog is infected or not, but infected feces cause a health hazard. An uninfected dog having contact with infected feces is one way that the infection can spread. Follow your veterinarian's suggestions for treatment and care. Kennel cough generally will run its course in 1 to 3 weeks with no treatment needed. However, some owners are annoyed by the constant coughing, so drugs to suppress the cough and reduce windpipe inflammation can be given through a prescription from a veterinarian. In more severe cases, antibiotics which are effective against Bordetella can be given. A dog which is actively coughing should not do any heavy exercise such as running, as this will aggravate the cough. Food and water intake should be monitored and encouraged to make sure the dog keeps eating and drinking. Collars used during leash walking may press against the dog's windpipe, causing severe irritation. Using a harness instead will help prevent this from happening.